My name is Sara Rocha. I am the representative for EUCAP in the Women's Committee for the European Disability Forum. I work in the Public Health and Primary Care Department for the University of Cambridge, and I am an Infodemics Manager for the World Health Organization. So I work in public health, and if I may share my, so my subject today will be autism is not an epidemic, misinformation is, and I'm going to be speaking a bit about the misinformation epidemic within autism. And this is very linked to the harmful procedures that are being done in Europe. The epidemic of misinformation in autism interventions, just as a brief historical concept, historically and to this day, the search for a prevention, treatment, cure for autism had a constant threat of human rights abuse and severe impact into the health of the autistic people throughout the world. We have it as a clinical construct. Autism is defined from an exterior perspective. That's why it's very much considered a behavioral problem, because it's seen as the behavior and it doesn't see the internal needs, and that behavior is just a part of the communication of those needs. So the pathologizing and medicalization of autistic core traits, and I mean more the social difficulties or the sensory difficulties, led to a main line of research of cures and treatment, finally now being shifted by participatory research with autistic adults and autistic researchers. But obviously this led to decades of focusing on autism as a main pathology to be cured instead of a disability to be supported. There is no official medications or therapy specifically for autistic core traits. So we do have speech therapy for speech difficulties, or we have occupational therapies also for sensory issues, but there's nothing specifically directed to autistic core traits after decades and decades of research. So this creates an opening in the market for solutions. And that's where the misinformation comes from. The promotion of damaging therapies and the promises of cure, sometimes by healthcare professionals, makes parents believe that if they do not try these solutions, they're not giving the best care for their child, and enter a sunk cost fallacy. Sunk cost fallacy meaning they put a lot of money into it, so they start seeing results even if they don't necessarily, if they didn't happen necessarily. All this created a very lucrative business of alternative therapies in Europe, not just in Europe, but in Europe too. Oops. So what is the information problem? According to Dr. Paul Carbone, a chairperson of a subcommittee on autism at the American Academy of Pediatrics, he said, many families of children with autism, between 50 to 75% in some studies, pursue complementary and or alternative therapies. This is a very, very high level, a percentage of people, family members pursuing other options. And although some of those options are not necessarily harmful, they can be within the autistic reality. So it is important to speak about the framework of how, as an autistic, we can see those complementary and alternative therapies. In the UK, it was done a Westminster Commission on Autism report called A Spectrum of Harmful Interventions for Autism. that define several critical points on the needs for regulation of this type of treatments. And it points out the Research Autism website lists over 1,000 therapies, treatments, and interventions for autism. Some suggested interventions are well researched, well understood, and are recommended by the National Institute for Health and Care Excellence. However, others have no evidence base or are harmful or illegal, yet are still promoted and sold. This happened in Europe still, and that's what I want to call for your attention. So there's a vast range of harmful psychological, medicinal, social, dietary, and chemical interventions that are assumed as autism therapies. So what is infodemics? So infodemics is basically the management of this misinformation, and where does this come from? So why this autism has so much misinformation at the moment? We have lack of clear guidelines on interventions that are evidence-based and the ones that are not. Even when we do have clear guidelines, they are very in medical language that are not accessible for a lot of people. There's also not a lot of information in non-English languages. So in Portuguese, for example, there is not a lot of information that clearly says which interventions are not evidence-based or are harmful and illegal. There's also insufficient regulations on the use of alternative, experimental, or unproven therapies in disabled people. Since it's not a medical procedure, a lot of the times there's no regulations that actually apply. So it's very difficult to actually go for those clinics that sell this type of therapies, or for personal, just people that sell them, that don't have necessarily a clinic. Also, there's an absence of mechanism for the reporting. So if we don't have a way to report to these people and these clinics, they will continue to do the same. And this is a very, very lucrative business, so they will keep doing it. So this information void is easily filled by disinformation. The different misinformation normally is information that are wrong for some reason. Disinformation is deceptive misinformation, which is people are giving you the wrong information on purpose, normally because of lucrative situations such as this one. So let's talk a little bit of the unproven and harmful interventions being used in Europe, because there's a lot of them. I'm not going to go in detail in all of them, but I do want to speak of how dangerous some of them are. So miracle mineral solution, or MMS, and the industrial bleach, I think it was spoken here before, sold as an all-around treatment. It can cause nausea, vomiting, diarrhea, symptoms of severe dehydration. We are aware that at least 7 people died in the US, 2 in Argentina, not counting hospitalizations. But it is very difficult to see how much people were actually impacted. Chelation therapy. Basically, chelation therapy says it cleaned the body of toxic chemicals and heavy metals. It's based on the idea that autism was caused by the vaccine, by the mercury in vaccine, that we already know that it's not true. It can cause severe several side effects, including cardiac issues, seizures, organ damage. In 2005, over 10,000 autistic children were chelated, with at least one 5-year-old autistic boy dying. Vitamin D, or Protocol Coimbra, this one is very typical in Portugal and Brazil. It's very common at the moment. So it's based on the idea that autism is an autoimmune disorder, and it prescribes vitamin D supplements 10 to 50 times over the safe upper limit of daily intake. Although you can assume that vitamin, it doesn't hurt, it does when it gets to this level of amount. So it can create a lot of side effects. Hyperbaric oxygen therapy believes that autism is caused due to low oxygenation in the brain. It can cause side effects. It basically puts you into a pressure tank. It can cause side effects such as ear barotrauma, fatigue, headaches, or claustrophobia. Neurofeedback. Neurofeedback is a computerized method based on tracking electrical activity on the brain, and they give you feedback on what your brain is doing for you to change it. Obviously, this doesn't necessarily have, from what I saw, side effects. However, this means to have a lot of touch and a lot of equipment around an autistic child that might be very sensitive to sensory issues. So this might cause a lot of stress nonetheless. And finally, stem cell treatments. This is the injection of a blood product. In the US, and university research showed that that's no evidence that it helped the autistic core traits. However, the same university opened clinics estimated to make $24 million per clinic a year. So the research showed there is no improvement, but it's still open, and there's still money being made out of this. In Europe, the headquarters of this type of treatments are normally in the EU, but the treatments are normally done outside of Europe for a very clear situation of regulations, and because it's more difficult to be done in Europe. There's several other treatments that I'm not going to be speaking here. Crystal therapy, ear candle, spiritual intervention, family constellation therapy. That's a very, it started now a lot in Brazil, in Portugal. Spiritual belief that thinks autism was caused by the autistic person being a serial killer or doing abortion in a past life. Aromatherapy, juice plus diet, raw camel milk, cannabis. We are aware of a situation of a 3-year-old boy that is taking cannabis by their parents. So there is several of them, as you can see here, including not letting children watch TV because there is an idea that it's caused by, autism is caused by watching TV. Essential oils, etc., etc. Some are worse and cause more harm than others. However, they all have some sort of harmful impact in one way or another. Chemical castration and electric shocks are being used in the US, although for now there is no indication that are being used in Europe. As you can see, this information, it is out there and people are talking about it, but it is very difficult to actually understand how much autistic people are this actually impacting, how much people are being hospitalized, how many people died because of this, and how can we stop it? And this is where I come with public health emergency. So this is clearly a public health emergency. We need to understand exactly how much this is affecting. And obviously, autism is around 2% or 1.9% of the population. So it tends to not get as much support within public health situations. At the moment, we are aware that for the parents, for example, to sell this type of harmful therapies, what happens is they rely on emotional testimonies of cures and improvements. They are administered by someone with no training or knowledge in medicine or autism. They're very, very expensive. Some of them are one cure for all, so it cures a lot of conditions, not just autism. Dismissive of the lack of scientific studies on the product service or negative studies. So they try to pass this as it is an advanced technique, it's a new thing, and so they are very dismissive of the lack of evidence, sometimes suggested by healthcare professionals. We are aware that some healthcare professionals, including doctors, are being advising parents of autistic children to search some of these harmful therapies. Emotional manipulation into thinking the parents that trying everything to help your child. So if you don't, you are a bad parent. and parents and the sunken cost fallacy. So if the parents do invest a lot of money on these therapies, they will sometimes see improvement, even if it's not necessarily connected to the situation that happened. They follow several of science denial points. Here are just some examples. But this is definitely a public health emergency, but there is no current data collection on how people are actually being affected, hospitalization or death because of the complementary and alternative therapies. So what can we do? And I will give a possibility, although it's not necessarily the only thing we need to do further to prevent this to continue happening. The infodemics approach. The World Health Organization defines an infodemic as an overabundance of information in digital and physical space, including mis or disinformation, accompanying acute health event such an outbreak. Obviously, this is started as COVID-19, and this procedure was developed for COVID-19. But I think after now we are able to share it and to broaden this term into different areas, namely autism. So Infodemics Manager is a data and evidence-driven, human-centered practice that strengthens public health systems to support behavior change. And this is based on social listening. So trying to understand what the public's questions are, what are their concerns, what are their narratives, what do they want? Then it's delivering high quality health information in programs. It's intervening through design, implementation, and evaluation of health information delivery, promoting and supporting resilience against misinformation. So teaching the parents and the autistic community how to fight against misinformation and create community engagement, and strengthening preparedness, planning, policy, and systems development. So this is a procedure that exists to handle misinformation online, that initially developed by WHO for COVID-19. They also develop an early AI-supported response with social listening. So this AI allows WHO to track the social listening online in social media platforms, which at the moment it is the main platforms being used to advertise and sell this type of treatments in autism. So it exists an approach to handle misinformation and to handle public health information exists, and I think it's a way or an option for us to be able to apply this against the unproven interventions that are being applied in Europe. So to conclude, what exactly do we need to do? We need to create clear guidelines on interventions that are evidence-based and the ones that are not. It should be in plain language by credible entities. We should have ways to share them and support them in a way that it reaches a lot of people that are in need for these informations. Another option, another point is to assess gaps in the regulations on the use of alternative, experimental, and unproven therapies in disabled people. How are we failing? One of the situations normally when these type of regulations are done against experimental therapies, sometimes they're not included disabled people. So there are countries that, for example, although it is more difficult to experiment on children, with disabled children, there is less restrictions in the law. So we need to understand how exactly these regulations leave openings to the application of these harmful therapies within disabled people specifically, because this is a very specific type of abuse that sometimes are not considered when mentioning abuse in directives and laws in our countries. The development of mechanism for easy reporting of these practices. There is several clinics that are clearly advertising in Europe these type of practices. So we should have a way to report them and to make sure that they don't continue to apply these practices in Europe. The infodemics approach, so it's incredibly important if we create programs of information with social listening to understand exactly what are the concerns, why 50 to 75% of family members of autistic people are open to alternative and complementary medicine or harmful therapies, and the delivery of proper intervention information. We need to add specific types of violence and maltreatment that affect disabled people within European directives and laws. There are several situations that are not added. Recently, the EU had the directive for violence against women and girls. There are some specific types of violence that are still done in Europe, such as sterilization of disabled people, including minors, including in my country, Portugal, that are not being considered part of violence and maltreatment, and it should harmful and unproven and experimental therapy should be considered a type of violence and should be treated as such. And finally, the creation of an European Commission to gather data on unproven treatments applications in Europe and their health impact. We are not aware of how many people are actually being exposed to this type of therapies and products, and we are not sure how much it is impacting their health, because we do know that a lot of them do have sometimes severe side effects, but unfortunately there's not a lot of information on how much exactly it's being done and how we can support autistic people and how we can also support parents into not going through this road of harmful therapies. And finally, I just wanted to quickly add this because this is a very good point on information in healthcare information, which is the ball. I don't know if I can say this because it's taped. Asymmetry, the amount of energy needed to refute it, it's an order of magnitude bigger than to produce it. So it's a lot more work for us to refute all against these harmful and unproven therapies and treatments than it is the energy needed to actually create them. So I'm going to stop the sharing. Thank you so much.